Now, about the other NCDs that I want people to know about, the diabetes is on the increase, and hypertension is on the increase. Kidney disease is on the increase. Recently, I was talking to a kidney specialist, and he told me that actually kidney diseases are more common than we think, because the majority of Ugandans don't drink enough water. Can you imagine just drinking enough water? I can ask people who are watching me now, how many have drank how much water since morning? And it's hot. So you need to drink at least 3 liters in a day, meaning you should be moving around with a bottle, and it should be probably now our cool thing to do. I have a bottle of drinking water, but the majority don't. And that's very, very risky for our kidneys. Now for hypertension, I want to emphasize again, for hypertension, again, it's a lifestyle disease. When I talk about lifestyle and non-communicable, these are two different things. Lifestyle means the way you live your life, the food you eat, the work you do, the activities you do, the habits you engage in. These expose you to what we call lifestyle diseases. Now, non-communicable, it means the disease cannot be passed on from one person to another. Now, for hypertension, for you to reduce your risk, you need to make sure that you're reducing the amount of time you spend while seated. I usually tell people that when God blesses you and you move while seated, of course you sleep while lying down, and you eat while seated, then you need to make sure you carve in your time when you do intentional, deliberate exercise. And we recommend that you jog, at least jogging or brisk walking, for at least 1 hour, 4 times a week. People talk about 30 minutes, but I want to say at least 1 hour. Make sure in a day you have 1 hour when you jog. You don't have to run like focusing Kuru. No, run at your pace. Make sure you sweat, you burn the calories. Now don't eat excess calories. These calories I'm talking about, all the carbohydrates, kosher rice, sweet potatoes, meat, all those excess. Have adequate vegetables, cabbage, broccoli, nakati, sukuma wiki, cassava leaves, what other leaves people? Bean leaves, pumpkin leaves, enough of those on your plates. Have fruits. So I want to say, just make sure 3/4 of your plate is full of these other things. When I say 3/4, I'm talking about a third being the posho and all those things. Because if you are not that, you don't need that excess. Of course, if you're in Chiga and you climb mountains to go and live, or you're a boda, or you're a wheelbarrow pusher and you're pushing